Meaningful Use by Erica Nicola for Professor Barker, Nurse 360. Meaningful use. For most nurses, using an electronic health record is part of our daily routine. Nurses who can relate to the nuisance of paper charting will usually sing the praises of electronic charting. With the adoption of EHR came the Health Information Technology for Economic and Clinical Health Act, which was designed to promote the adoption and meaningful use of health information technology. It was signed into law on February 17, 2009. The Center for Disease Control defines meaningful use as the use of certified EHR technology in a meaningful manner, for example, electronic prescribing, ensuring that the certified EHR technology is connected in a manner that provides for the electronic exchange of health information to improve the quality of care, and that in using certified EHR technology, the provider must submit to the Secretary of Health and Human Services information on quality of care and other measures. Goals. As stated by the Center for Disease Control, the goals of meaningful use are as follows: improving quality, safety, efficiency, and reducing health disparities, engaging patients and families in their health, improve quick care coordination, improve population and public health, and ensure adequate privacy and security protection for personal health information. Meaningful use ensures that electronic health records are shared and used appropriately and meaningfully to improve patient outcomes. Rules and incentives. Center for Medicare and Medicaid Services, CMS, has offered financial incentive programs to providers to adopt EHR use. According to the CDC, incentive payments range from $44,000 over 5 years for Medicare providers and $63,750 over 6 years for Medicaid providers. To receive an EHR incentive payment, providers must demonstrate that they are meaningfully using EHRs to meet specific objectives set forth by CMS. These objectives are described in the 3 stages that have been set forth by CMS. Stages. Meaningful use consists of 3 stages, all of which encompass rules and criteria that providers or facilities must meet in order to be eligible for incentive payment. Stage 1. The requirements in Stage 1 are focused on providers capturing patient data and sharing that data either with the patient or with other healthcare professionals. There are certain objectives that providers must meet. Core objectives are objectives that all providers must meet. There are 15. There are also a predetermined number of menu objectives that providers must select from a list and meet in order to demonstrate meaningful use. There are 5 menu objectives. A total score of 14 must be met. 2 years of successful meaningful use must be demonstrated before progressing to Stage 2. Stage 1 rules as follows. Reporting period is 90 days for the first year and 1 year subsequently. Reporting through attestation, objectives and clinical quality measures, and reporting may be a yes, no, or numerator-denominator attestation. Also, to certain objectives and measures, 80% of patients must have records in the certified EHR technology. Stage 2. Stage 2 retains this core menu structure for meaningful use objectives. For many of the Stage 2 objectives, the threshold that providers must meet for the objective has been raised. It is expected that providers who reach Stage 2 in the EHR incentive programs will be able to demonstrate meaningful use of their certified EHR technology for an even larger portion of their patient populations. Stage 2 eliminated from Stage 1 and added new core and menu objectives and deduced a new amount of core and menu objectives that must be achieved. Stage 3. Stage 3 includes flexibility within certain objectives to allow providers to choose the measures most relevant to their patient population or practice. Stage 3 will lead to improved outcomes. Stage 3 objectives with flexible measure options include coordination of care through patient engagement. Providers must attest to all 3 measures and must meet the thresholds for at least 2 measures to meet the objective. Health information exchange. Providers must attest to all 3 measures and must meet the thresholds for at least 2 measures to meet the objective. And public health reporting. Eligible professionals must report on 2 measures. Where are we today? Today, CMS has renamed Meaningful Use to Promoting Interoperability. This change will move the programs beyond the existing requirements of meaningful use to a new phase of EHR measurement with an increased focus on interoperability and improving patient access to health information. References. Thank you very much.